Hello, and welcome to part 2 of our phenomenal webinar series about navigating menopause at work. I am Francesca DiMeglio, the editor of HR Exchange Network, and I'd like to introduce you to Christine Muldoon, SVP of Marketing and Strategy at WebMD Health Services. She will introduce the rest of our panelists momentarily. In the meantime, before I turn it over, I have to do a little bit of housekeeping. First of all, we're delighted to have such a great audience, and we want you to be very much involved in the discussion that we're having. You're welcome to use the live chat, which you should find across the bottom of your screen, and you can use this to get to know one another and ask questions of our panelists and each other, and you can also use this to alert us of any tech issues you may be having. For now, let us know where you're joining from. Also, you can send questions through the Q&A button, which is also at the bottom of your screen, and you can keep the questions coming throughout the discussion. There will be time for a Q&A at the end of the talk. And remember, those of you participating in today's live session qualify for SHRM credits. After the event, be on the lookout for those in your email box. And without further ado, I will turn this over to you, Christine.
Thank you, Francesca, and welcome everyone to part 2 of Menopause in the Workplace series. I see so many of you calling in from different locations. Some of you are in some hot spots of snow already on November 1st. My name is Christine Muldoon, and I will be leading this panel discussion today. We chose to do a series on this topic because menopause is a universal experience for women. And despite that fact, there is very little discussion on the topic or support for it in the workplace. And for those of you that joined part 1 of Menopause in the Workplace, I spoke with Jyota Sharma, who's the founder and CEO of Terra Cares, on the unmet global health needs in menopause awareness, diagnosis, and management. Our webinar chat was hot with examples of women's experiences, including cultural differences, the impact menopause has on women in the workplace, and the opportunities when organizations increase their support for women going through menopause. In the United States, it's estimated that the annual cost for missed work days due to menopause symptoms is $1.8 billion. I just want to repeat that, $1.8 billion. That's according to a recent report by the Mayo Clinic. If you haven't seen that report, I highly suggest you look at that. There are a range of menopause-related symptoms. We all know them: hot flashes, night sweats, mood changes, sleep disturbances, migraines, depression, and cognitive difficulties, otherwise known as brain fog, all which impair women's quality of life and adversely impact women daily, the workplace being no exception. We learned that menopause is not a one-time event, but hormonal changes that impact women for many years, even up to 10 years. These hormonal changes also create other medical concerns such as osteoporosis, heart disease, diabetes, and other conditions. Women going through menopause are the fastest growing demographic in the workforce. There are record numbers of women entering menopause daily. Each woman's experience is unique and can impact women as early as in their 20s and 30s. But if we were to use 50 as a proxy for menopause, about 25 million women pass through menopause each year. These are women that play an important role in your workplace. Many are in their midlife, a time when they are experiencing career success, they're in leadership roles, and they're contributors to the economy. And yet, even as a record number of women in the workforce experience menopause and its associated symptoms, it largely remains a taboo topic at the office. But today, we are changing that conversation. And joining me on part 2 of this webinar series are 3 individuals contributing their unique viewpoints and experiences to this conversation. And I'm going to ask each one of you to introduce yourself and really provide your perspective that you're bringing to today's webinar. So Andrea, can I start with you?
Sure. Hi, I am Andrea Herron. I lead HR for WebMD Health Services, and I think what I want to bring today is just that lens toward inclusion and what we can do to make sure that all employees are supported. I particularly focus a lot on communication and benefits and the mental health viewpoint. I'm a big advocate for all those things. So that's what I'll be bringing.
Good morning, good afternoon. My name is Bruce Foyt, and I lead partnerships for WebMD Health Services. And please don't adjust your screen or take a quick look at if you're in the right webinar. I am the male perspective today on the call, and I'll be really looking at two different points of view. One is my role looking at partnership solutions. I'll provide what is out there in women's health in general, but more specifically in menopause. And then I'll also provide my perspective as a leader in WebMD and how that reflects on menopause at the workplace.
And I'm Stephanie Hansen. I've been a certified health coach with WebMD since 2005 and have talked one-on-one with thousands of women who are experiencing perimenopausal and menopausal symptoms. In our coaching conversations I've had with these women, many bring up the subject as a topic of embarrassment or a failing on their part, but we want to change that stigma. My hope is that women will have a work environment where they can more openly discuss what they're dealing with and to feel more supported in the workplace.
Thank you, Andrea, Bruce, and Stephanie. I'm so excited for this chat today. I want to remind everyone that we will be taking questions, so use the Q&A function to ask any questions you may have. And now we'd love to get to know a little bit about all of you. We know that women experiencing menopause are the fastest growing demographic in the workplace. This means we must talk about it and be sure we are providing the right support. So would love to hear why you are all joining our webinar today. So Francesca, if we could pull up our first polling question and really just tell us why you're joining the webinar today. Maybe you've experienced or you're currently going through menopause, one of the stages. We'd love to hear from you. Maybe you're a people manager. You want to know how you can be more supportive for women on your team. Maybe you're considering leaving your job because of your menopause symptoms. You're looking for actionable insights to really help you feel more supported because maybe you're not getting that from the workplace. Or you have a friend or family member that's going through menopause and you just want to learn more on how to support those individuals as well. So we are going to just give it another second or two. And if we can collect those results and show those. Okay, so we have about 59% of you currently or have gone through the menopause stages. So definitely want to learn more, and that's great to hear. I love the fact that 39% of you are people managers and you want to learn more and be more supportive. We're definitely going to cover that today. Of course, anything we share here can be used to support any of you who have friends or family members also going through menopause. And we're going to provide actionable insights so that you don't get to the point of feeling like you need to quit your job. So thank you so much all for completing that. Regardless of your reason, we are here to share information for you to know more about menopause. And to kick us off, I want to share with you that, I don't know if you all saw this, but just last week, there was an article in the Boston Business Journal about Blue Cross Blue Shield Massachusetts CEO, Sarah Iceland, and her very honest story of personally struggling with menopause symptoms and her charge to support employees going through the same challenges. So as an employer, Blue Cross Blue Shield hosted a presentation on menopause and they answered questions from staff. The thing that stood out to me in that article was that 400 people attended the session. It's quite amazing that many people wanted to learn about menopause in the workplace. So Andrea, I want to kind of kick off this panel noting that particular article, but more that we're starting to see more and more. Why are we seeing this shift in having conversations about menopause in the workplace, and why is it becoming more of a priority?
Great question, and I have a lot to say about it. So I would, I guess, first just note that the world is continuing to regroup after a huge period of instability with the global pandemic, and employers I have found and seen and experienced are especially focused on stabilizing their employee retention, productivity, and their culture and what that means now. And people have realized that we are the same human inside and outside of work. So in order to have that good retention, productivity, and culture, you have to focus on the whole person and not just the output. And I guess from our lens as a well-being company, we know that menopause is equally a part of women's overall health and wellness. And women, as you mentioned, are critical to the fabric of the workplace, the economy, and just life in general. So we can't ignore something that impacts every woman at some point during their life and work career. So we collectively need to step up our knowledge and support of these major areas of healthcare to maintain that healthy workforce. And the Blue Cross Blue Shield story, I think, is just one of many where we are recognizing we can't expect people to leave their personal lives at the door when they come to work, be it in a physical place or even their work screen. We have to understand that there are personal things going on and we need to have a connection. This was first evident, I think, when we first started video meetings from our homes, and these boundaries and barriers of work and non-work life kind of eroded. And when we're dealing with something significant, it shows up in every aspect of our life. And so those employers who recognize this, and we are starting to share more information in social media, and it's getting a little bit of energy around this topic. And so employers who pay attention and recognize, oh, wow, this is, you know, half of the population, they're going to step towards a more inclusive workplace. And that inclusion is going to help their employees want to stay and feel supported, which then does what? Right? We already know this. It's you're going to have a happier workforce, more productivity, more creativity, better problem solving, and tenure. So when organizations foster a more supportive, age inclusive, high performing workplace, it benefits everyone. And this is just the latest topic that we're realizing needs to be included, similar to physical health used to be, you know, take a walk, you know, eat right. Now it was mental health. And now it's menopause.
Yeah, I like the point that you made, Andrea, about like, you can't leave your personal life at the door, no matter where your workplace is. And so all the symptoms and the concerns and the challenges that employees are facing, I mean, you can't hide that at work. It actually puts more stress on individuals.
Yeah.
Stephanie, I want to ask you, so I'm just thinking back to the poll results, and you know, definitely individuals participating on this webinar, they want support and information. And some people actually said, like, you know, I could have answered several of these options. I mean, that's how important this topic is. And at WebMD, we offer health coaching, and you're representing it from a health coach perspective. There are so many topics our health coaches support. And I would say that we are somewhat unique in that our health coaches also support women's hormonal health, including menopause. And so your role as a health coach is important to this conversation. And if you can maybe share a little bit more about what you're hearing from women in the workplace as coaching participants, what questions are they asking?
Right. Yeah. In my coaching conversations, I'm hearing a lot of frustration from women who are entering perimenopause or have become menopausal. Their bodies are going through a lot of changes, and not all of them make sense. Many women say what's worked for them in the past for managing their health may no longer be working for them. They may be struggling with menopausal weight gain, or they may not be able to fall asleep or stay asleep where maybe they once didn't have a problem with that. They may find they're having more mental health issues or having hot flashes during the day or night sweats in the evening due to declining levels of hormones, progesterone and estrogen.
Thanks, Stephanie. And I want to add that the word frustration, like I hadn't thought about that, but
Yeah.
that's important because, you know, I'm not sleeping well at night. Then I come to work and then all those, like, I'm tired, the emotions, and feeling very frustrated because I don't know what's going on with myself, nor do I necessarily maybe feel comfortable sharing it with others. I also would like to let everyone know that there is a resource in the dashboard under the resources that describe how WebMD health coaches support women's hormonal health, which is part of our broader employee well-being coaching program. So just so you have access to that as well. Of course, studies show that employers are also starting to focus more on the needs of women from preconception, family planning, caregiving, of course, preventive care. So Bruce, I have to ask you because you lead our partnerships. You're our VP of partnerships. You're always looking at trends, speaking with clients about needs in all areas of well-being. And you definitely take a very strategic view of partners in our ecosystem. So knowing this is such an important topic, what are you seeing regarding support for women's health and more specifically that stage of midlife and menopause?
Yeah, well, what we're seeing is employers are really looking to enhance benefits and resources, but they're all certainly evaluating options carefully. They want to know how to add the most value at their organizations. And sometimes that means filling gaps in current offerings with more inclusive benefits. And by also really paying close attention when employees say they need better support for specific areas, such as mental and emotional health that we touched on a little bit, and stress, but more importantly, menopause. They leverage employee surveys, focus groups to help and define their strategy and to assess their needs. And, you know, when I'm looking across the market and looking and scanning the industry as it relates to women's health in general, let alone menopause, you know, there are a number of point solutions that fit in various areas of the women's health spectrum, be it from birthing years to postmenopause and everything that falls in between. So when we're looking at point solutions that may look or focus on pregnancy, pre, post, or during, or fertility, or raising children, ages 2 to 12, or those dreaded teenage years, and into all the various stages of menopause, we look at areas that are focused on digital solutions that are also complemented by human interventions. And as Stephanie talked about, coaching really helps to support those digital solutions. And coaching can be at various levels. It could be specialists. It could be all the way up to docs or other specialists in the area. But by complementing the digital with the human intervention is very, very critical in what we're seeing a lot out in the marketplace. And finally, I'm starting to also see solutions, point solutions that tie into the supervisor. So for those going through a solution, they can oftentimes connect with their supervisor, and it works both ways in that you're educating the individual with that condition and so that they can bring a more awareness and understanding around it, but it also starts to teach or educate that supervisor on how to approach their employee that's going through that condition. And so there's been a lot of interesting point solutions out there that are leveraging that. And when you think of the various point solutions, oftentimes they're missing those primary or prime stages around menopause. And as we talked about last week, menopause typically falls between the ages of 45 and 60. And of course, what we learned in part 1 with Jyoti is that the age range really varies based off ethnicity, as well as other conditions, bringing on early menopause. And menopause obviously can last for women differently, some 5, 6, 7 years or longer. And what we're also hearing in the market is that these generations now don't want what their mothers had in for menopause. That stigma of, you know, keep it quiet, just work through it, move on, or unfortunately, you know, leave the workforce, which is not what anybody wants. And so it's important that when you're looking at it from a holistic view of well-being and wellness, is that you're connecting the dots of your conditions and tapping into the resources that the employer or the program may have. We certainly don't want women dropping out of the workforce in their primary career years. So where can we help? The impact of overall wellness program can support employees through all life stages. So when you think about well-being, we have our core capabilities around awareness and education, and at WebMD and of course at other well-being organizations continue to think about the whole impact on life. Stages of life impact overall effectiveness of what we're trying to deliver. So exercise, nutrition, mindfulness, a number of things that Stephanie and Andrea mentioned are all these types of well-being programs that can assist and support women going through the natural phases of menopause. And as Stephanie shared, if, let's say, you're talking to a health coach, they can make recommendations or adjustments to support key dimensions of well-being that may be impacting during menopause, such as sleep, and provide suggestions for improving and supporting you.
Thanks, Bruce. And I just want to call out because so many people are chatting here. And because menopause is not one size fits all, there's not one list of symptoms. I mean, some are calling out, that explains why I can't come up with words, or I'm not sleeping at night at performance, or I never heard of brain fog. I appreciate that because it varies by each individual, which sort of plays into, I think, Bruce, what you're saying is that, you also aren't looking at like, is there one solution that's going to support women with menopause? Yeah, maybe digital or content that helps educate us, right? I would love to know that I'm not alone and what I'm experiencing is normal for this stage. But also it's so personal that, having prepped for this webinar, having these conversations with Stephanie as a health coach and being able to just ask her like, okay, here's what I'm feeling, or here's what I'm experiencing, and having that personal conversation about how I can, sort of respond and support myself is important too. So there's a lot, we're not alone, and there's so much going on. And so it's not one size fits all solution. The other thing I wanted to share with everyone is Mercer does this health and benefits strategy survey. And for the 2024 survey, they found last year, 37% of employers plan to offer one or more specialized women's health benefits in 2023. And that number has risen to 46% for employers looking ahead to 2024. But the percentage within that are planning to offer menopause support has more than tripled since last year's survey, but the metrics are still very low. It's a 4% to 15% in 2024. So that's still low. I would love to see that a whole lot higher. So what I'd like to do is just understand where you believe your organization stands on this topic. So we're gonna pull up our second poll here. And what we'd like to know is very simply, does your organization offer menopause support? So Francesca, if we can pull that up, and you can see we're giving you a couple options here. Yes, my organization, my employer offers menopause support today. Maybe you're in the planning stages to offer something next year. We offer maybe specialized women's health benefits for sure, but not menopause specifically. Maybe you don't know, which we know is a common problem, or we just don't offer any menopause support today. So those are the options. Love to know where your organization stands as you are aware. And if everyone can go ahead and select those. Okay, let's see what our results look like. Sorry, I just had to be a little disappointed there because 49% of you, so almost half, don't offer any menopause support that you're aware of at your organization, understanding, you may not know. But the next is, I don't know. Some are offering specialized health benefits for women, but not specifically menopause. And 8% of you offer menopause support today. So I know that there was someone saying, like, I'd love to hear what support's being offered. We'd love to hear that as well. We'll talk a little bit about what we're seeing in the market as well, but and 5% of you are planning to offer menopause support in 2024. So let's drill down in some of this a little bit more. So we're going to shift our conversation a little bit. Bruce brought this up, talking about people managers and the topic of menopause in the workplace. And so there's been studies and surveys that show that many managers just don't feel confident talking about menopause. And there's a number of reasons for that. They don't know enough about it, or how they can really help. And menopause, unlike maternity, where to some degree, I don't want to say it's 100%, maternity is a little bit more clear. Menopause is a little bit more complicated. As we've said, women's experience is different, not to mention, again, the stigma behind the word menopause. And again, if you joined our part 1 webinar, Jyoti shared some pretty stigmatizing quotes from, one woman being called lazy or not concentrating or too emotional. By the way, there's nothing wrong with being emotional. And the other thing to say here is that adding menopause to your corporate dictionary, I'll say, doesn't mean you have a company culture that empowers the menopause conversation. There are several key elements which really need to be included, and that should be things like training managers to understand menopause and how to support employees. Insights on benefits, like helping employees know what support your organization may provide to help. Also ensuring, and Andrea alluded to this a little bit too, a supportive and safe environment for open conversations on the topic. And of course, there's so many other things that we're going to discuss right now. So Andrea, part 1, we talked about how there is not a single menopause experience. It's not one age. Symptoms are not one size fits all. There are certainly racial, ethnic disparities in the menopause experience. So of course, we shouldn't expect one solution or one benefit is going to cover everyone in the workplace. So from your perspective, what are some of the benefits that you're seeing being offered or considered for the workplace and women related to menopause?
Sure. I mean, it is nuanced and layered and stigmatized and hidden. What's complicated about that? Everything. It's very complicated, but it is something we can take steps towards addressing. So here's some things I'm seeing. The first one may seem basic, and maybe it is, but we aren't necessarily doing it. So let's just start there, and that is with education. So I saw in the chat, the people being impacted shouldn't have to be the ones training others on it, and I would say that is true for a lot of issues. But I think women and all of people, we just don't even know the basics because, as Bruce alluded to, it's been hidden there. We don't want our mother's menopause, which was, poof in the air. No, there's no truth to it. It's hidden, it's secret. And so because most people generally don't know about it, we don't know what to expect. And also, because it's women's healthcare, we know that has historically been under-researched and underfunded. And so there's just very little information readily accessible out there. So as a first step, you can do what we're doing today and start to educate and start to bring a series or even one session on what it actually is, what are the phases, what are the symptoms and signs to all employees. Just because it impacts men, because it impacts women, right? This is a everybody thing. And then you can move into more tailored sessions for your leaders to address stigma and how to talk about it, which I think we can all agree, not all leaders and managers are really great at communication. So that's, something we can work on. But as far as more traditional benefits, making sure you have coverage for counseling and medical care. Perhaps it's with a health coach, perhaps it's just your regular physician, but making sure that you have some EAP or some kind of services to help support people going through this, because you might feel like, I don't even know what's going on with me. Am I losing it? What's happening? And we've seen that in the chat, so having someone qualified to talk to and having that part of your benefits package, critical. But you can't just offer it. You have to promote it, because what I have noticed is that EAPs in particular are the most underutilized benefit a company has, because everyone knows about it, but it's usually 12 clicks down on the employee intranet and there's a phone number or a link, and then you got to remember your password. Make it easy. The easier you can save a hot link, you can share it, you can post it, you can advertise that it's out there, the more people are going to use it. And that's true for all benefits. Another one, employee resource groups or support groups to kind of recognize and give women a space to talk about these things in the workplace. We can, again, train managers on how to support employees generally, but also I think some unconscious bias training is another item you could add to your list, because, as I saw in the chat earlier, we're talking about the recency bias, we're talking about halo effect, these things that women maybe have to go to more appointments, so they're not here, and the recency effect, there are very real human biases that you need to train and get in front of so they don't adversely impact women. There are also certain, hormone replacement therapy treatments, and keeping those affordable and accessible through healthcare, and just offering increased, maybe specialized providers if, your regular plan isn't enough or isn't giving women the support and the access they need to that coverage. There could also be some kind of, list, whether or not you publish it, but we're talking reasonable accommodations, reasonable adjustments. Could be something very simple as a desk fan. I may or may not have one right off screen here for when it gets, randomly hot in my office. Maybe there's flexible working hours, or break times can be more flexible because maybe you need to go stand outside for a minute. Training, raising awareness, just these little things that can give people more flexibility to take care of themselves. And then finally, I just do want to touch on what Christine mentioned. I don't have, all of the facts and figures, but it is absolutely true that women in different socioeconomic, in different cultures, different races, they experience most medical conditions differently. And that is also true for menopause. So having some kind of awareness and making sure that you are not just keeping a very tunnel vision of what you think it should be, but opening to all experiences for all people in your workplace.
Yeah, Andrea, thank you. And I want to add one point, because you brought up hormone replacement therapy, HRT, and we're not necessarily addressing some of the clinical components today, but I do want to add that the North American Menopause Society has lots of resources, including some pretty comprehensive video series on many topics, which include things around like cardiovascular disease and menopause, hormone therapy, as well as disparities in menopause. So go to menopause.org. You can get some great insights there, because it is kind of going back to your point, Andrea. It is about educating. And I've just learned so much going through this, prepping for this webinar series, and sort of educating myself as well. There was also, I've not only educating, I've seen so many studies too. So there was this Bank of America study. It was titled Break Through the Stigma. Great research, which found the #1 reason employers don't offer menopause benefits is because employees haven't asked for them. So everyone on this call, go back to your employer now and start asking for menopause benefits. I think this is interesting. It sort of does get back to that stigma taboo as well, right? Well, I don't want to ask about it because then it seems like I can't do my job, all of that. And Andrea, I know that we talk about the expected range of menopause. And someone had chimed in on the chat, like, well, 20s and 30s, it can happen there as well. There's a number of reasons for that. Question for you: should managers assume and like just make adjustments for an employee based on their age range?
No, don't do that. No,
I had to ask.
For the record, not a good idea. While it does impact, all women of a certain age at some point, we have absolutely no way of knowing, because it is one of those invisible things. And we never want to assume a medical situation or condition or experience for anyone ever. Just if that's the only bit of this webinar you take, please take it. However, we do recommend that managers are leveraging regular check-ins regarding work and overall well-being. And the better you have a relationship structured and set, and the more trust that has been built, the more likely people are to feel comfortable and safe bringing something like menopause up. And so if you do have that relationship and someone does raise their symptoms, or any of the menopause phases, it is important to acknowledge that's a normal stage of life, and then see what adjustments or changes can be made. I think this absolutely goes back to what we were just talking about, is that managers do need to understand the symptoms and what is offered, and that isn't going to happen on its own, right? I mean, managers usually are people who are really good at their job, have a knack for leading groups, and now they're the manager. Usually there's not a big training on how to support mental health, how to support overall well-being, how to support menopause, right? So we have to get more intentional about it, and understanding and giving them the resources and language of what's okay to say and not okay. Because one thing I have seen, which is very understandable, is a lot of people don't want to cross the line. They don't want to say anything inappropriate, so then they don't say anything at all. Mm-hmm. And that makes someone feel even more alone or unheard or unseen. So it is a delicate balance, but if we can bring it up as an organization, the higher top down, the better. If we can use that language, like you said, the corporate dictionary, the more okay it makes people feel. It gives permission, whether or not they think of it that way, that it's okay to discuss. And so again, that company-wide training, or even just talking about it, even just during open enrollment. I mean, you could start small, but if an employee has to bring up the word menopause, and it's the first time they've ever heard that word spoken aloud in the whole company in their experience, that is way more terrifying than if it has been mentioned and brought up and they think there's some acknowledgement that that is something that they could talk about. And so having support groups, champions, ERGs, or just basic understanding can create that environment for an employee to connect, feel seen, feel heard, which, by the way, is what we all want as humans. And you're going to have a much better outcome of people feeling safer to kind of be who they are and bring what they need to bring, so they can do their job. Because that's like why we're here, and people want to do their job, but they just might need a little extra support or understanding as they figure out how to do that.
I want to kind of reiterate the ERG support group, champions, whatever you want to call it, because we decided we're going to talk about menopause here at WebMD Health Services and do a webinar. And it was sort of like, we're going to talk about menopause. And now I'm like, in front of the whole company, we have a webinar on menopause.
Totally.
But it's seeing like this sort of chat that's happening right now, getting groups together and feeling like you can connect and have that conversation. And then it starts to roll a little bit more, and you get support and champions and bring in training. You do have to start somewhere, and there does have to be someone that's going to be a little bit vocal, a little bit of a leader, and just want to talk about it. Okay, so we're gonna switch to Bruce here, because someone just chimed in and said, my supervisor's a guy, and I feel like he doesn't want to hear about my lady issues. So Bruce, here's what I'm going to say. The majority of men remain unaware of the impact menopause and perimenopause can have on female colleagues. We know that. There was a study called Online Menopause Center, which found that 61% of the 500 men that were surveyed admitted they would not know what to do if menopause or perimenopause was affecting a female colleague's ability to do their job. And more than half also admitted to having been unaware that many women are forced to reduce their hours or give up work entirely because of their menopause symptoms. We've talked quite a bit about this, Bruce, so you and I are pretty open and transparent on this topic. But I mean, I think it's important to have this conversation, right? Because it's not necessarily someone's fault that because they're unaware, it's like we're not talking about it. So, okay, we would totally appreciate, Bruce, your perspective and transparency on this topic.
Absolutely, and I really think it starts with, yes, I agree that being a male leader in the organization, we need to be educated more on menopause, and perhaps in women's health in general. And if my wife's on the call right now, she'll be chatting that yes, he needs a lot of education, but men should also be able to access menopause support to help their colleagues and their partners too. I wouldn't be here today if I didn't feel at least somewhat comfortable in discussing women's health conditions, let alone menopause. But in some cases, menopause can dramatically affect relationships. And we've talked about this. Andrea was touching on it as well, of just at the workplace. So when an employee's wife or partner experiences symptoms over a long period of time, it could start to affect the employee's relationship and well-being. So the workplace should not overlook well-being and vendor partners when providing that type of support. And, I kind of reflect on last week with webinar 1, where there were a few brave male attendees, and they had questions. And, one that kind of pops into mind is there were some technicians that called in, and the technicians had stressed because their wives were experiencing menopause, and they don't know what to do. And it's another example of how you can't leave your personal life at the door as you come into the workplace. Employers are looking for their employer for support, be that female, be that male. Another participant last week had chatted in that said he does try to talk to his female counterparts. And this is getting a little bit more at what Christine had asked, when he realized that something is bothering them, but they don't want to talk about it. And I can feel your frustration. It takes time. And at least with this panel, the WebMD leaders, they've certainly been open in the last few weeks, and almost sharing too much at times as we've embraced this topic, but to talk freely about it and become comfortable with it. It's hard for men to talk about it oftentimes with women because they don't want to be inappropriate or come across as inappropriate. And we certainly need to be careful with our words and how we approach the situation, but we certainly don't understand all of the phases or what challenges women are facing, which is why open training, for everyone is so important. And, even having similar to the guest speaker that we had last week that could come into an organization and talk openly from the expertise that person has to the overall population, again, regardless if it's males or females. And when you think of well-being from the holistic approach, I support having a holistic approach in the digital and human intervention resources like lifestyle coaching that Stephanie touched on. A solid well-being offering can provide awareness, resources, and support to anyone, anywhere, and at any time for everyone. But I'll add my perspective as a male on the leadership team. I would appreciate being trained as well. I don't know how to approach, in all cases, my female peers, understanding what they are going through or how I can support them. And if you're in a leadership position, I really think there's like 4 pillars, if you will, that need to be built in the foundation, which is first, and Andrea touched on this, education and awareness. So you need trainings. You also have to show or come across that you have confidence in talking about it. Certainly no one's going to come and talk to me about menopause if I don't have some sort of education, understanding, and come across as I have confidence in talking about the subject. And then we should be prepared to provide clear support. And Andrea covered a number of areas such as flexibility with your work schedule, the temperature, wardrobe, things like that. And then you have to spearhead it. If you're a leader in the organization, you have to make change. And and if that means talking about the policies or support or resources, I think you have to be very open to that and really push that forward. It should be expected. And then finally, on a personal note, and as I was building up for this webinar and just having conversations with my wife and as her and I have went through our various stages of our life of getting married, having kids, getting older together, and now her going through menopause, we certainly joke about, wrestling over the temperature for the room, or God bless that they have heated and cooling seats in cars, because we have our arguments there. It is important that we all talk about it. And it's important, if there are any males that are listening in today, talk about it with your wife, talk about it with females, because that's the only way you're going to have some sort of confidence or comfort level on addressing these subjects.
And thanks, Bruce. And I kind of going back to the ERGs or champions, you might be surprised if you have that sort of group in the workplace, that males, if you're open enough, males will want to come as well, just to your point of wanting to learn more. So there are two words that come to mind as I personally think about, as I'm going through perimenopause: stigma and ageism. Many women welcome menopause support, but as we've kind of been talking about, we may not feel comfortable asking for it either. There's this stigma that if I ask my employer for support, it may be a reflection of my inability to do my job. We talk about ageism, I've been doing everything to be a strong leader, but I also don't want to be reflected as like the old person in the boardroom or in the office. I don't want to damage my career growth. Like I've reached my, the top. Many women are just uncomfortable having personal conversations in the office about this. And all of this sort of, as we've seen, leads to employees not asking for help for benefits at work, understanding what's available. There's just certainly that lack of communication. And so as two women on this panel, Stephanie and Andrea, and since we are having this open conversation about menopause in the workplace, love to hear from both of you about what you're experiencing, and from your experiences, what you believe would help. So maybe Stephanie, I'll start with you first.
Yeah, I kind of want to circle back and talk about what the WebMD coaches experienced. We knew that we needed more information to be able to help women navigate this stage of their lives. So our training team developed training for coaches to better understand the process of entering menopause. All of our lifestyle management coaches have undergone training on the hormonal changes women experiences in their lifetime, including hormonal changes surrounding perimenopause and menopause. Often coaching participants will request a female health coach who is comfortable discussing concerns surrounding menopause. So we've assembled a team of female coaches who are comfortable having discussions around peri and postmenopausal concerns. This group of coaches brings their knowledge on wellness topics as well as their own personal life experience to help navigate this stage of life. Our coaches are well versed in self-care strategies, but the peri and postmenopausal woman may need a more targeted approach. So through one-on-one coaching, we can get into a deeper discussion about issues that are troubling her and what may be impacting her concerns and what can be done to lessen or eliminate symptoms. We coaches can get into discussions about the connections between self-care and symptom management. And like Andrea said, employee assistance program is always an option for those wanting additional support in their lives. We coaches offer EAP on any call where it seems appropriate. Last week, during part one of the webinar, Jody talked about the fact that historically women learned the answers to their questions about menopausal changes from female family members. Now they're more likely to ask older female friends or trusted coworkers what to expect. But not everybody has that kind of female support to hold those discussions. Women are spending more time in the workplace, so what better place to be learning about menopause management than at work? If I tell my telephonic coaching participants that I'm almost 60, I get a sense, I can sense a shift in the conversation. These female participants are more comfortable sharing what has been concerning them. We can begin to talk about next level strategies to manage their symptoms, or at the very least, I can empathize with her situation and provide moral support and some resources to consider, such as, again, the North American Menopause Society or the Office on Women's Health. I'll also say, I think this is a time in a woman's life that up until now, if she hadn't been practicing a high level of self-care, that she may start experiencing body signs that it's time to begin making some steps towards better self-care in the future. Our bodies are always talking to us, and it's up to each of us to slow down to figure out what the body is saying. Because if we don't listen to what our bodies are whispering to us, the body's voice gets louder and louder. I tell my participants self-care is not selfish. Self-care is about replenishing personal resources so we can continue to care about our loved ones. Also, caring for ourselves and not being a burden to our loved ones is one of the greatest gifts we can give them.
I love that, Stephanie. Thank you so much for reinforcing the need to focus on ourselves, for sure. And I like the fact that you talk about like the association and sharing your personal experience with participants and their openness then to want to ask those questions and have a conversation. Andrea, how about you? What are you experiencing and what do you think would help?
You know what, my day-to-day experience, I think that would be the most relevant for this group is how much this conversation overlaps with the focus on mental health. So I do a lot of work in that space. And yes, I have my fan and I get hot and I go for a walk. But aside from that, you know, one radical shift that we have seen in the past few years is people being more open and conversational about mental health and how it impacts all of us at work, outside of work. This really kicked off with the pandemic. And quite frankly, the younger generation, there is so much less stigma around mental health because we all have it. A lot of times when we think of mental health, we think of mental illness, and that's not what we're talking about, right? Menopause doesn't mean that you're now a sick person. It means that you have something that you need to take care of in your body, just like with your other physical health or your mental health. And so you've got to be brave. One thing I have learned in my personal experience is that anytime I talk about either mental health or menopause, as we've all been talking about it a lot more, it opens the door for other people to know that you're a safe person to talk to about that. Every single time I bring it up in a presentation, a webinar, a company meeting, I always have people follow up with me afterwards because now I'm someone that they can talk to. So even if you're not the CEO or even if you're not a manager, talking about these things and being someone that is a safe person to talk to, you will start to have people that group together. And again, we want to be seen, and we want to know that what we are experiencing is normal. And we can't do that if we are being silent. And so we've got to be brave. We've got to open that door if we want something to change. And so in the workplace, you know, you got to find those people you feel comfortable. And the more, again, we can train and talk about it openly and have resources and bring men into the conversation, because I think we need to give men some credit that they do want to help and they do want to be supportive, but they are completely unequipped to do so because a lot of us are unequipped. We don't even know what's going on. So I think the more we could talk about it and the more I have talked about it and brought it up, it just opens the whole can of worms in a very positive direction.
Thank you, Andrea. You're getting some thumbs up as well. People love self-care is not selfish, Stephanie. And even talking about like many people already are doing exercise today, but now they're like, you hit a plateau or things have changed, and listening to your body, and then, knowing that you have to make some changes. We probably should have made this webinar an hour and a half. We're not going to get to all of our pieces here, but I want to kind of talk a little bit about how menopause, we have been saying, is not just a gender or an age issue. It is an organizational issue and topic, which is certainly impacting a huge number of employees, and we're just not talking about it enough. We've shared several reasons during our webinar why. The lack of awareness or understanding, the stigma, cultural norms and attitudes, ageism, perceptions and fear of discrimination. That has been a lot in the chat too. Limited workforce policies and benefits. We would love to change the conversation and have employers acknowledge the impact menopause has on well-being and employee performance. And we all do believe that by taking steps, employers can become one that promotes a culture of understanding and also fosters psychological safe workplaces that really do destigmatize a natural, healthy part of aging. So I'm going to wrap this up with one more question that I'm putting out to all three of you. What are the risks employers may face if they choose to ignore menopause as a workplace issue, topic, concern? What are the risks? Andrea, I'll start with you first.
Sure. I mean, I think the risks are very similar to the risks of ignoring, other needs that humans have. As people live longer, as we work longer, this is inevitably going to become more and more prevalent. And so by doing something about it, you are keeping a healthy, engaged, productive workforce, and you're reducing your turnover. And guess what? If you're known for being a healthy workforce who cares about the people, that's more referrals, that's better business, that's better customer service. I mean, it's just a waterfall of positives. And if you don't do it, you're going to continue to have turnover. You're going to continue to leave out a huge portion of your available workforce that doesn't want to work for you because it's not good there.
Yeah, I would pile on to that and everything that Andrea said, but I'd also encourage employers to get out there and go after it. Don't wait. Don't wait for this to be a change that comes years later. I really think it's, not to belabor the pun, but it's hot right now. And let's get out there and let's provide programs and services for everyone and move on it. Stephanie?
All of the above. I just wanted to say, I think the time has come. The time is now. The future is female. We have to start advocating for concerns that women are experiencing, or they're going to feel unhappy, unheard, disgruntled. It's time.
And I'm going to add that from the research I've seen, women who have access to menopause benefits and support are significantly more likely to recommend their company as a great place to work, where they feel more supported and ultimately connected to the company. And that's really a reflection of your culture too. So, because the workforce is aging as a whole, we have to start to think about the relevant benefits that are going to be important for all employees. We have 2 minutes left. I don't see any questions coming into the chat, into the Q&A section, but man, is the chat going crazy. So I've tried to sprinkle in some of the comments. I know that I feel like a lot of you are sharing from your perspectives. Joint pain is a big topic right here. I have yet to experience that, but I'm anticipating that coming soon. So I hope that we did share a lot of valuable information for you all to really think about how you can be an advocate for women in your workplace, men as well, and really get the discussion going look at ERGs, look at champions to support menopause, think about health coaching. If you have questions that come up or you'd like to learn more, you can certainly contact us. The email address is connect@webmd.net. Feel free to email us if you want more information and want to learn more. Don't forget to download the one pager that we have provided on women's hormonal health and how health coaching can support that. And Francesca, I'm going to turn it back over to you to thank everyone for joining today.
Hello, everyone. Thank you so much for such an insightful webinar. The live chat was booming again, as Christine mentioned. So thank you, audience, also for your comments, questions. I hope you all enjoyed this, and I hope you join us next time. We'll be getting together again on November 17th for what an HR Exchange talks about the future of learning and development. Thank you again, WebMD Health. All of you did an excellent job, and we'll see you next time. Bye-bye, everyone.
Thank you.
Thanks so much.